Hello and welcome to my presentation on the role and responsibilities of community and public health. This is my final project. Ray Young, Community and Public Health class, Instructor Francis, September the 1st, 2014. Introduction. Community-based public health programs were created to reduce disparities in healthcare access, quality, and health outcomes. While there are national program guidelines, these programs were designed to give states the flexibility, design, and implement solutions based on local needs. The role of community and public health in the well-being of the population. As the as a policymaker today, I feel working to develop and implement health reform that will improve the accessibility, affordability, and quality of care and contain health care costs. But while universal health insurance coverage is important, it does not guarantee access to care. Community based public health programs can help to prevent illness, disability, and premature deaths and have an important role to play in reforms that expand and ensure meaningful access to coverage and care, especially for the vulnerable populations. Describe the public health organization structure. Public health organizational structure is to improve the health and health care of all Americans. The nature of government public health agencies at the state and local levels varies considerably across the country. Legally and traditionally, states are the primary authorities for public health. Federal policy influences but generally do not dictate a state's local public health practice. In examining the legal and ethical dimensions of public and community health service, one, the public health should address principalities and fundamental causes of diseases and requirements for health aiming to prevent adverse health outcomes. Second, public health policy programs and priorities should be developed and evaluated through a process that ensures an opportunity for input from community members. Third, public health should seek the information needed to implement effective policies and programs that protect and promote health. And fourth, public health institutions should provide communities with the information they have that is needed for decisions on policies and programs and should obtain the community's consent for the implementation. In analyzing funding of public and community health service, revenues collected is the process through which the health system receives money, primarily from households, businesses, and ministries of finance and donors in the form of grants and loans. Out of pocket payments are in consideration, voluntary insurance rates by income, voluntary insurance rates by risk, compulsory insurance, general taxes, earmark taxes, and donations from non governmental organizations are all in consideration. When discussing the role of communication in community and public health programs, vital statistic data is a major collection of communication data on births and deaths, mobility surveys of the population, also notable and reportable disease statistics from the National Health Interview Survey, case registries like cancer registries, behavioral risk factors, surveillance surveys are ways of all communications. United States Census Bureau is the demographic data that is gathered through the World Health Organization. This is the conclusion of my presentation, and I hope you got all the information that was needed in the presentation. Thank you. My name is Ray Young, and have a nice day.